I started Impact Physical Therapy in 2003, and we are going on 17 years now being in private practice. So we are very fortunate. I started the practice because I felt very strongly about treating patients one-on-one. I didn't want to use aides or assistants or techs, and I felt like patients who go for physical therapy should see a physical therapist. And so we slowly grew from a room to a clinic. I really like working with seasoned physical therapists. I like the fact that they're ethical, having ethics, having integrity around their work, and putting the patient first. I think it's really important that we are always putting the patient first in terms of customer service. So the philosophy in our clinic is if a patient's acute or if they need to get in, our therapists know that they need to fit them in during that day, that we really do need to accommodate the patient. We currently share our office with Seattle Sport and Spine, which is down the hall from us. They are a separate business, but we collaborate together. We share patients, and we also have the physicians down the hall to go to if we have any questions or we need, some more information regarding an MRI or x-rays. So it's really great to have two doctors down the hall. We work with a massage therapist here also collaboratively, so we often share patients with her. We'll get feedback from her. Again, I think the main philosophy of Impact Physical Therapy is that we really are a mom and pop clinic. We focus on the patient. We really try and provide good care. And the other thing I think is important is that when we reach a level where the patient is not progressing, we will refer the patient out. We're not here to exhaust their insurance benefits or keep them longer than what they need to be. If they're not progressing, then our job is to direct them in a way that, we might try something different. One of the things that we really pride ourselves on is that we are private practice. We are non-corporately owned. A lot of the physical therapy clinics in the area have been bought by big corporations. We are part of a bigger network called the Puget Sound Private Practice, where there are 7 other private practice clinics in the region that we all get together, we share information, and so we support one another in terms of retaining that status of being private practice. What does that mean? We try and tell people again, we don't use ancillary staff. We are just PTs, and we do treat our patients 40 to 45 minutes. Sometimes if a patient doesn't show up, we'll even treat them longer until the next patient shows up. So we love that. We love being able to have the flexibility to spend time with our patients.